we have in Iraq a cardiothoracic society, which is one of the oldest in the area. It was established in 1967, maybe earlier, I'm not sure. But regarding the vein work, we don't have enough or even any vein introduction or research or even a vein of name of vein in our meetings until 2 years ago. Of course, this is expected because vein work in Iraq is a duty of vascular surgeons, and we were already busy with emergency conditions. We are thoracic and vascular postgraduated physicians, and these two things are filled with emergency conditions in Iraq in the last 40 years maybe. So the vein management must be, these are not must be emergency, must be elective conditions, was late. Until 2 years ago when we established our veno-lymphatic group of Iraqi Cardiothoracic Society, and we took very nice actions forward. In the picture you can see our wonderful Professor Sergio Giannassini, who we invited him for our annual meeting, and he was, I think he was happy in Iraq there. And we were also in the international meetings. We attend Bali in Indonesia, we attend Italy VIPP, we attend the French Society annual meeting, and lastly we established our first Iraqi summit for peripheral vascular interventions, and important part of it was the vein work. We hear there very nice stories of success about first interventions for acute DVT as interventions, and many other stent interventions with the superficial venous management also. And we are going for the annual meeting in October in the International Society of Lymphology in Antalya, and we received an invitation for Buenos Aires in UIP, but we were so unlucky because of we have no diplomatic representation of Argentina and Iraq, so we cannot attend. But we applied for the UIP, and we hope that we will be accepted as a member of UIP. Honestly, to be in the world standards, we need to fix the gaps first and improve what we already have. Of course, as vein work, there are something related to us as phlebologists or vascular surgeons, but there are something unrelated to us, which constrict and prohibit you from going further. Of course, scientific knowledge is a problem. What about a person have to be well mastered in thoracic surgery, in arterial surgery, in vein surgery, in lymphatic surgery, and some of them also cardiac surgery? Of course, you cannot be Tarzan, and this will affect your venous knowledge. This is a problem. How can you convince a vascular surgeon to be pure or pure specialized in veno-lymphatic in order to be in a world standard of a phlebotomist? This is a problem, of course. And we need supporting medical team. For me, for example, I took the international mastership in surgical lymphedema. I want to practice lymphatic surgery, but what about massage therapists? We don't have such discipline in Iraq. This is a problem. What about interested radiologists in veno-lymphatic problems? Yesterday we heard from Germany who gave us a presentation about lymphatic surgery that he sent for MRI and only one surgeon in a whole Germany. It looks even in Germany it is a problem. And we know from our one colleague from Uruguay that they don't have MRI facilities. Also, what about Iraq? It is difficult to find an interested or efficient person. So how can I go to the radiologist and tell him, please be interested and please be good? This is a problem. My diagnosis will come from the radiologist, and then I will take action accordingly. How can I fix this? This is unrelated to me. And of course, about the system, we have problems in the infrastructures, whether governmental, non-governmental. How can I convince governmental or non-governmental to bring a good microscope for me and our colleagues to do first surgeries in lymphatic surgery, which might be successful or not successful? It is about an investment and should be fruitful. And of course, according for all of these, I used to tell companies, please, we want such in Iraq, but they don't reply. For example, Bad Company, it is well registered in Iraq, but for the rotarix, for 5-6 years, please, we want single rotarix or machine in Iraq to practice on it with no response at all. And of course, this affects also our research. There is no good cooperation. It is not cooperation, but for me, when I apply to journals, I can see they are refusing for reasons, honestly, it is non-logic. And even if I want to do some research together with others, I can see they will say, okay, Haidar, why not? Let's proceed. Okay, I have this research project. Of course, I can give you a name, but I could not. I have this research project, for example, about sclerotherapy use in hot and cold weather, and to compare the efficacy. Okay, what a nice idea, Haidar. Proceed. What do you want to do? I'll do 1, 2, 3, 4, 5. Okay. Once I am in 5, there will not be any reply to repeated series of emails. I am very happy today, and yet the day before yesterday and the day before yesterday, because I can see these things have started to be improved. And honestly, yes, if we can do something together between our group, as a group and as society issue, I want to put this between two brackets. If I put your names in my social media or in my groups, of course, I can expect many doctors will contact you on personal level. But honestly, if we want to fix our gaps, if we want to get respect from others, we have to move as a society from Iraq, not as personal. I can't say personal, Haidar. I have no problem, but it's not good. Neither for Haidar, neither for it. So if we can do something together as a society, I will be so happy. We are not poor society, we are rich society. We can invite not one surgeon, many surgeons. We can arrange many workshops, no problem. But the problem is that the other don't take action to be in Iraq, other than Professor Sergio Giancini indeed. And that's it. If I can see positive impact, whether in this hall or outside, believe me, we can arrange for a wonderful coordination, cooperation, even for you. We have cases, if I open my case book, not Facebook, you will be surprised what do we have, the quality of patients. It is very, very interesting patients indeed. So this is all I have from Iraq. I will be so happy for whatever help you can give to us. And thank you.
Thank you, Khibir, for this nice presentation and good exposure and honesty of your words. I appreciate that. But as a matter of fact, you have a real problem. You are asking for cooperation, and you have how can we help you to encourage other Iraqi population surgeon? I think this you have to do first. You have to encourage your doctors, fellows. This is the first step.
Nice.
First step, you have men interested in training. Next step, company. We have to convince company to go and supply. Company are usually money talking, money thinking. They are afraid to support with some instruments for improper usage that may affect this instrument and get negative impact on this instrument.
Nice.
This is second question, or the second step. First step, you have to encourage your fellows and colleagues. Second step, you have to ask for, I think all of us are happy to come to Iraq and start work with you for a month or two, training for a certain subject who is in the scope of your fellows. And in this way, I think the company is ready and happy to support this project. The next step, you will be happy to introduce many doctors and many of us willing also to share our knowledges together and get your knowledges and to introduce your cases and let us share ideas how we can treat these cases. For example, lymphedema. Lymphedema, you have many cases of lymphedema and you don't have enough trained personnel to do manual lymphatic drainage. I think this is very easy, and I think all of us have trainers will help to make these centers. You can train a lot of your therapists to get well trained to do a lymphatic drainage massage and then get their proper elastic compression. I think this will give you the best reputation that you make a real change in the population of Iraqi. I think Kathleen can share her knowledge to tell us how can help Iraqi to develop